Hi and welcome everybody. So I'm going to do this session today just to explain about the endpoint assessment requirements. And so by now you should all be working well towards your duties. And we need to really be aiming to get those finished off by the end of July at the latest, because we need to prepare you for your gateway. So just to remind you of what that looks like. So your community health and wellbeing practitioner apprenticeship, you can see, was a 12-month program. And we need to just run through the duties in which I need you to hold in mind ready for the endpoint assessment. So we have 10 duties in total. Duty 1, using preventative approaches to promote health and well-being in groups, communities. So that's things like social prescribing, signposting, government agendas, things like 5 a day, smoking cessation, etc. Duty 2 looks at help to build community resilience and identify strength and capacity and resources. So that's about you creating your own toolkits and resources and looking at your third sectors like your charities and organisations to help promote health and well-being. Duty 3 looks at providing information, advice and guidance about local services. So again, this comes into your toolbox, but remember there is now the Hub of Hope where you can find information about absolutely everything that you need to. Manage referrals for a range of services. So if we think about the IAP services, the wellbeing services, some of those are self-referrals. You've got things around the food charities, normally needing a referral there. Or again, maybe substance misuse services. A lot of substance misuse services want those self-referrals. Applied behavioural science. So within your program, we looked at cognitive behaviour, we looked at some EMDR, we looked at hypnotherapy, and not as techniques in their own right, but just how they help people to slow cognition and how to think a bit clearer with more clarity. We looked at implementations and actions, so setting out strategies and policies to promote health and wellbeing at community levels. So again, thinking around your smoking, your substance, your drinking, your weight loss. Community public health message and information to promote health and wellbeing individuals. So again, you've got in your toolkits websites and charities and organisations. So, and remember, there's different for different ages. So children, you've got things like psoriasis or the mix, working your way up to kind of things like the Samaritans, etc., or NSPCC. So depending on the age and whereabouts. Manage data and information to contribute to the project. So looking at the effectiveness. So since introducing your community health and wellbeing practitioner, have you seen a reduction in the amount of times you need a GP? Operate within legal frameworks. So that's understand your codes of practice, set them by skills for care, and then take responsibility for your own professional development. So your continual professional development journey. Again, looking at skills for care there for those guidances. As well as maybe Gibbs or Ralph reflective frameworks. Under each duty, you've got your knowledge and your skills, and that's what we cover down here. And we've covered all of that within the classes, as you will remember. So let's now just have a look at that assessment plan. Now, before we go into Gateway, we need to make sure that we meet the requirements. And here we need to make sure that we have a portfolio of evidence, typically a minimum of 3 case studies undertaken throughout the course of the apprenticeship. So you've done lots of case studies because in yours, if we look at the assignments here, we've done a case study, your essays for all of your skills. So they're combined. So you don't need to do any more for your gateway evidence. That's what it is. We just need to download those and produce them. And again, the case study should include examples of how apprentices support individuals and how they work within their local communities. So this is really the one that you're probably going to have to do here. So we need to look at a minimum of 1,000 words and the structure looking around your backgrounds. And this is because they're going to use that case study for your endpoint assessment. Now, you're going to have a multiple choice test. So you're going to have 30 questions. You've done lots of questions with me so far, so hopefully you will all pass those no problems. You are then going to have the pass mark. There is a minimum of 24 out of 30. You're then going to have a demonstration of practice. So this is the performance evidence. You're going to be given 3 scenarios with examples where you're going to have 5 minutes to read the scenario, 20 minutes to carry out the activity, and 5 minutes to follow up with questions. And then you should have, again, the professional discussion, I think. Was there not a discussion on this one? I thought there was a discussion. And there's your professional discussion. And that's based upon your portfolio, the skills, knowledge, and behaviours. So when we look at the scenarios, you can see here what the scenario is. So outcome 1, based on a service user, the apprentice will have a discussion with a service user, an actor. This is the first time they've meet them, and that's to co-produce an action plan to address the service user priorities. So again, here you're going to need to listen to what they're saying, look at what the problems are, and then you're going to come up with some ways forward. Scenario 2 looks at an activity using community or groups. The apprentice will be presented with something around a community outcome, and drawing on their experiences, they can say how they would collaborate with a diverse range of stakeholders, that's a different range of people, to help promote that organisation. And then the last one there is based on a scenario involving a service user as a follow-up meeting. So working alongside an actor, they'll look at a pathway through to action plans. So when we think about what we're going to be doing here, we need to go back to our toolkits. Okay, so let's just remind ourselves of everything that we've covered. You're going to go back to your toolkit. And remember, I gave you everything at the start of this course. So if I'm speaking to a service user and let's just say they've got a problem, they're struggling with their weight loss, I might find a nice metaphor about weight loss. So something that's going to be motivational and uplifting. I'm then going to probably look at some health promotions. So we'll give a health promotion. We've got our Change for Life scanners, our 0 to 5K couch stuff, and our eating well. So we can talk about some of those. What I then might want to do is look at their self-esteem and think about their well-being, and therefore they may need some mental health skills. It's just something to promote their independence and their wellness. And remember, when we listen to what people are telling us, we're going to be going through that information, finding the key points. So if somebody's not eating well, then what else might it be? So if we go back here, have they got an issue around debt and money? Can they afford their food? Have I got to do a referral to get them some additional money? Or do I need to do a referral to the food bank? So lots of different things. Again, think around your toolkit. Is it things around weight loss, some social prescribing or social prescribing around money? But they've got a low opinion of themselves. Can we refer them to talking therapy? And then finally, some other strategies. Maybe we need to just teach them some emotional intelligence or some coping skills, some problem solving skills. So by using your toolkits, you're able to listen to that person and then come up with some really good outcomes for them. And again, it's what you've been doing in your skills. So when we've been going through these and you've got your example scenario here, you've gone through and answered those anyway. So that's that. And then you've got your professional discussion then. So going through that professional discussion, based on the evidence, the word that you've given, you'll see down here that there'll be a link of how the work is assessed against what piece of work. So you'll know where you're getting your stuff from. So in the multiple choice test, this is what you're going to be assessed against here. That's there. In the demonstration tasks, this is what you need to know. So you need to know about your local services. Okay, so that's what you need to know. And then there's your skills. And then in your professional discussion, this is what you should be able to talk about and answer. Okay, so that's your skills, your knowledge, and your behaviors there. Thinking about your overall grade. So if you're worried about your grades, I'll explain how they work. So basically, your multiple choice test is pass or fail. Your practice is pass or distinction. So again, if you read this guide, it gives you what to do to get the distinction grade. And the professional discussion, again, is a pass or distinction. To get a distinction, you must get a distinction in both the practical and the professional discussion. If you only get it in one or the other, you'll only get a pass. And if you fail any part, then you fail. Okay, so it's really important that you do that. And again, yes, you can have a retake, typically within 3 months. We need to make sure that you've been upskilled and you're ready to pass the tests. So what I want you to do from now till the end of July is go through your 9 duties. Make sure you've answered everything. Have a look at this endpoint exam and make sure you're happy to sit that test. By the end of July, August, we will be providing you with your portfolios and then looking at doing some mock stuff with you to get you ready for your EPAs in September. Okay? Any problems, let me know. Take care. Bye for now.